Hi there, this is Kira Lesley for Debunking Addiction at HealthyPlace.com. Like the majority of Americans, I was shocked and saddened to hear of Robin Williams' death. I have an average or maybe even less than average familiarity with his body of work. I've never seen Mrs. Doubtfire or Good Will Hunting, but Aladdin was one of my favorite movies as a kid. And I did know he was quick-witted, brilliant, and troubled. I knew he had struggled with substance abuse and even attended a treatment facility in my state. I knew he had been clean and sober for many years, and I tend to feel a special affinity for celebrities who've shared some of my struggles. Also, I'm inspired and motivated by people who have managed to achieve long-term sobriety, whether they're celebrities or not. Robin Williams and I shared some struggles, and we also had some different struggles. Since getting sober, I have not felt suicidal, and in fact, even when I was drinking, I didn't have the same constant battle with suicidality that I have seen in many of my close friends. I feel very fortunate in that regard. I don't know what Robin Williams' personal battle was like, and I don't want to address the reports and rumors about why he took his own life, but some things he was very open about during his life. One was his battle with depression and loneliness, and another was his battle with drugs and alcohol. People with substance abuse disorder are at much higher risk for suicide than the general public. There seem to be several contributing factors that make this the case. It's pretty apparent that a person in the throes of addiction, what with all of the havoc it wreaks in their life, may feel more inclined to take their own life. And of course, drugs, including alcohol, lower one's inhibitions and make it easier to do things that we wouldn't do sober. But what about the person who hasn't touched a drop of alcohol or a drug in many years? Unfortunately, Robin Williams' tragic death reminds us that even after we give up drugs and alcohol, we are still at a high risk for depression and suicide. Again, I am not speculating on why this man took this action, nor am I suggesting that he did it because he was an addict alcoholic. I am saying his death is a reminder that even people who seem to have a grip on their addiction can still be suffering tremendously from other mental health issues and related mental health issues. In fact, oftentimes we use addictive substances and behaviors to avoid having to deal with underlying issues. I know that's been the case for me. I have had to deal with depression and obsessive compulsive disorder after getting sober, and there has been a lot of trial and error along the way. Also, I know it will be a lifelong process of controlling rather than curing my mental illness. Robin Williams apparently did address his problems, and he had some success in doing so for decades, until something pushed him over the edge. Hopefully, those of us in the recovery and mental health communities can learn from this that we are never really in the clear. Even if we put down the substances, we still have to deal with our minds. I hope for comfort and strength for Robin Williams' loved ones, peace for him, and that perhaps we as a society can grow from this tragedy so that people with or without substance abuse problems can have better help and an easier time getting to that help.